like children are playing happily. But yes, we are talking about epilepsy. What is epilepsy? Epilepsy is a condition that affects the brain and causes frequent seizures. Epilepsy is the fourth most common neurological disorder and affects people of all ages.
Symptoms of epilepsy. First, anxious. They always have that problem. Second, they have confused during this conversation between them and another particular person. For example, while they are talking about a person about any topic, they will forget what they are talking about. Third, the loss of conscious. And the fourth, they will always jerking their arms and leg. They are mentally and physically not stable in their life, always have the not stability and the scaredness. They can't do anything without the scared.
Sometimes falling over without knowing why. And these were later identified as myoclonic seizures.
Diagnosed when I was 12 years old, but I remember having my first seizure when I was 8.
I was diagnosed at, I think, age 12, after multiple tests and a lot of visits to the doctor.
I was at home when I had the tonic-clonic seizure, so luckily my dad knew what to do, and then I was rushed to the hospital because this was the first time it happened, and the doctor at emergency, he said that I have epilepsy.
The first time I had a seizure, I didn't really know what it was because I hadn't had one for such a long time, so I didn't really tell anyone. But then it happened again, and obviously I had to do something about it, so contacted a neurologist, and yeah, we started from there.
Nothing at all. I didn't even know what it was. Didn't even know it existed.
It's very, very terrifying to have your life changed in an instant, to say 1 minute you're normal and then the next minute you're, I suppose, different. It's very altering, life-altering. I saw myself a bit differently too, so it took a while for me to accept the change as well.
During the epilepsy attack, first, give them a big space or let them into a room, empty room, and the ground must be normal. They can't have any carpet or beds. It's more good. Second, should give them the air to breathe. For example, let them breathe a fresh air. Third, avoid any sharp and hard things. Let's clear away from them. For example, any furniture or any knife. It will be dangerous. When they are jerking, they have a chances they can take out it. during the epilepsy attack, don't try to hold their hand or try to stop the jerking movement. It will dangerous to the patients. And don't put any chocolate or any candies or any Panadols into their mouth. It also not a good performance to them.
First aid for a seizure.
Oh, Harry, you're just having one of your seizures. Don't worry.
Protect them from injury.
Don't worry.
Do not restrain them.
Be all right. Just listen to my voice, Harry. Just going to check your breathing. You're all right. I'm just going to roll you over, Harry. Okay.
When the seizure is over, help them to rest on their side with their head tilted back.
There we go. Okay. That's it.
Remember, make them safe and prevent injury.
Epilepsy. In epilepsy, the electrical signal in the brain become scrambled and there are sometimes sudden bursts of electrical activity. This is what causes of seizures. In most of cases, it's not clear why this happens. It's possible it could be partly caused by your genes affecting how your brain works, as around 1 in 3 people with epilepsy have a family member with it. Additionally, epilepsy can be caused by damage to the brain, such as damage from a stroke, a brain tumor, a severe head injury, or drug abuse or alcohol misuse, a brain infection, a lack of oxygen during birth. For epilepsy, treatment can help most people with epilepsy have fever, seizures, or stop having seizures completely. Treatments include medicine called anti-epileptic drug. These are the main treatment, and then surgery to remove a small part of the brain that is causing the seizures. A procedure to put a small electrical device inside body that can control seizures, and then a special diet ketogenic diet that can help control seizures. Some people need treatment for life, but you might be also stop treatment if your seizures disappear over time.